continue our series of smart surgical anatomy. Stop bleeding. There is 5 surgical arteries of the abdominal wall. How we will master the abdominal wall vascularity. Why this matter? Why surgeons care? Of course, we have incision planning, protecting the rectus sheath blood supply. It's very important. Laparoscopic port placement, avoid hemorrhagic zone, and flap surgery. So we have to understand the vertical collateral circuit. So about the anterior abdominal wall, there is superficial and there is deep. About the superficial, all arise from the femoral artery. They are only 3 branches: superficial epigastric, superficial circumflex iliac. Any surgeon master the cesarean section will experience these branches: superficial external pudendal, which run medially towards the genitalia. What about the deep system? There is superior epigastric, which is a terminal branch of internal thoracic artery, enters the sheath from above. Inferior epigastric, branch of the external iliac artery, enters the sheath from below. And there is deep circumflex iliac, branch of the external iliac artery, runs along the iliac crest. What about the Waterloo of the abdomen? It's an example of a porto-systemic junction. There is many porto-systemic junction in the body, but we have to discuss here about the anterior abdominal wall, which is a clinical sign like Caput Medusa. As we can see, a para-umbilical vein, portal vein, anastomosis. What about the posterior wall? We can call the aorta tree. Posterior abdominal wall vascularity. There is parietal branch supplying the wall. Inferior phrenic supplies the diaphragm. Lumbar arteries, which are 4 pairs, and median sacral like a tail in the aorta. What about the 3-sided aorta? It's like a formula or map to memorize the branches of the aortic tree. Ventral unburned. They are supplying the gut. Celiac artery, superior mesenteric artery, inferior mesenteric artery. Lateral, bird, urogenital, suprarenal, renal, gonadal. Posterior, which is bird, phrenic, and lumbar. What about the trap? Which artery is used as a landmark for deep inguinal ring? It's a very important question. Every surgeon is aware about it. Inferior epigastric artery is the answer. What if we ligate external iliac? Does the lower anterior abdominal wall will lose all the blood supply? The answer is no, because there is superior epigastric from the neck anastomose to inferior epigastric artery. Finally, there is superficial branches from femoral branches and deep blood supply to the anterior abdominal wall, vertical from epigastrics, and the posterior wall is covered by the aortic branches. Inshallah, you will find this video useful, so subscribe and follow the channel to see the series of surgical nerve map in module 6 in our anatomy course.